Nigeria, 1940s. Villages sprawled across the savannah. Mud brick houses dotting the landscape, fields golden under the harsh sun. Life was hard, but hope endured until disease arrived. Dr. Thomas B. Johnson, a young scientist recently returned from training in London, quickly realized that the continent faced a catastrophe. River blindness, malaria, and other parasitic diseases were ravaging communities. People were dying not in wars or disasters, but from infections that could be prevented or treated. Entire villages were disappearing, crops went untended, and despair spread like wildfire. Thomas had grown up in a small Nigerian town. He had witnessed friends, family members, and neighbors succumb to preventable illnesses. Their deaths left a mark on his heart, igniting a determination that he carried into his studies. He had trained under some of the finest minds in Europe, mastering epidemiology, parasitology, and public health. But the real test awaited him back home, where knowledge alone would not suffice. Upon arrival, he faced skepticism. Local officials doubted the efficacy of new treatments. Communities feared the strange medicines brought by an outsider. Logistics were nightmarish. Roads were rough, communications scarce, and supply chains fragile. Every trip to a village involved days of walking, navigating rivers and savanna, and convincing people that he was not a charlatan. Yet, Thomas persisted. He began mapping the spread of diseases, noting patterns, breeding grounds for insects, and the seasonal rise and fall of infections. His notebooks became blueprints for intervention, a combination of science, strategy, and relentless observation. He pioneered methods for treating river blindness using drugs that could be administered safely to entire populations. He trained local health workers, empowering communities to participate in the eradication effort. He devised creative solutions: mobile clinics on boats navigating rivers, medicine distributed during local festivals to encourage participation, educational programs disguised as storytelling for children. Every obstacle, geographical, cultural, logistical, was met with innovation and tenacity. Years passed. Villages once crippled by disease began to recover. Children who would have gone blind thrived. Adults returned to work in the fields, and life regained a rhythm it had lost. Thomas' work was not flashy. There were no headlines, no medals, only steady, persistent progress. Yet the impact was monumental. Entire regions were transformed. Diseases that had plagued communities for generations were brought under control, and the social fabric of countless villages was restored. Even when funding was scarce and political support wavered, Thomas continued. He negotiated tirelessly with governments, collaborated with international agencies, and refused to leave communities behind. His life became one of sacrifice. Long hours in the sun, sleepless nights, and constant travel through difficult terrain. Yet he never wavered, never lost sight of the human lives at stake. By the time the continent recognized the scale of his achievements, Thomas had saved millions from suffering, blindness, and death. His methods became models for public health interventions across Africa, and eventually worldwide. He demonstrated that science, when combined with compassion, persistence, and an intimate understanding of local contexts, could achieve what armies and politicians often could not: the preservation and transformation of human life. Thomas' story is a lesson in courage, resilience, and vision. True heroism does not always make headlines. Sometimes it manifests in unglamorous, exhausting, yet life-saving labor. His life reminds us that one person, armed with knowledge, determination, and compassion, can alter the fate of entire populations.